My name is Jonathan Brickett, and I'm the Fire Chief of the Amesbury Fire Department. I've had an ongoing issue for about 4.5 years, where I'd go into a problem called SVT, supraventricular tachycardia. My heart rate increases in the range of 200 beats a minute. And I only know this because of my background with EMS and my wife being an emergency room nurse. It came and went, and I just kind of took care of it on my own with very little intervention with a doctor. And the last time that I went into this, I was actually at a fire. And I was treated by the paramedics on the scene, taken to the hospital by ambulance, and at that point it was time to get involved with a cardiologist.
I met Chief Brickett in the office after he had severe palpitations at a fire. He actually had the diagnosis all figured out. He had an EKG, and he knew it was supraventricular tachycardia. It made my job easy. We did some testing, an exercise test, an ultrasound test, and I looked over that information and said, look, this thing is not going to hurt you, but it really might distract you again, and we have a guy who can fix this. I sent him to Isaac Pourati, an electrophysiologist.
Chief Brickett was referred to me by Dr. Conway. We discussed his situation and all the options. We decided that the best thing for him would be a procedure called catheter ablation.
Dr. Pourati did a procedure called an ablation, where a skinny catheter about the width of a piece of spaghetti is inserted in a vein, goes up to the heart, and we find the circuit that causes the arrhythmia, and we make a little line on the inside of the heart that breaks the circuit. Since then, the chief has not had any problems, no recurrences, and the problem is basically cured.
I went in early the afternoon and came out that same afternoon, late in the afternoon. Within 2 weeks, I was feeling really good. The follow-up after the procedure pretty much gave me a fairly good, clean bill of health. I had a stress test, I had electrocardiograms, and they couldn't make the process happen again if they tried. So, as I use it, I hate to use this term, cured me. It's actually opened my eyes a lot based on my job, what I do, and it's sent me back to the gym. My caffeine consumption is a cup a day versus 5 or 6. It's just opened my eyes throughout the whole process. I've been dealing with doctors pretty much my whole career. I work in the field in emergency medical services, and prior to becoming the fire chief here, and met a lot of doctors, and he definitely has a very good bedside manner.